Understanding Lamotrigine. What you need to know. Welcome back to my channel. My name is Pharmacist Michael, and today I have an important topic to discuss. And that topic is Lamotrigine, or Lamictal. Whether you're taking it, considering it, or just curious, this video will cover everything you need to know about this medication. But before we dive in, don't forget to hit that subscribe button and ring the notification bell so you never miss our health-related content. Let's get started. What is Lamotrigine? Well, Lamotrigine, often sold under the brand name Lamictal, is an anti-seizure drug. It belongs to a class of medications known as anticonvulsants. But that's not all it's used for. It's also prescribed for bipolar disorder to help manage mood swings, as well as the prevention of migraine headaches and to treat trigeminal neuralgia in some patients. How does it work? Well, it works by stabilizing electrical activity in the brain. It does this by inhibiting the release of certain neurotransmitters that can cause overexcitement, which is often seen in epilepsy and bipolar disorder. The dosage of Lamotrigine can vary depending on the condition and how well your body responds to it. But what I can tell you is we always start slow. And the reason for this is because we want to make sure the patients don't develop a rash to Lamotrigine, which is probably the most concerning side effect of this drug. If a rash does develop, the medication should be discontinued. Avoid skipping doses and never double up if you miss one. Another thing that's important to note is if you stop taking this medication and restart it, you also have to go through the initial titration schedule again. Like any medication, Lamotrigine can have side effects. Common ones include dizziness, headache, and nausea, especially during the initial stages of treatment. But, like we mentioned earlier, in rare cases, severe skin rashes can occur. So it's essential to report any unusual symptoms to your physician immediately. Lamotrigine has so many drug interactions that I can't even begin to list them in this video. But always inform your doctor of all the drugs, supplements, and herbal products that you are taking to make sure they don't interact with Lamotrigine or any other drug that you're taking. Feel free to email me at michael@pharmacistmichael.com if you want me to take a look at your drug regimen. I'd be happy to give you advice. Who should not take Lamotrigine? Well, Lamotrigine might not be suitable for everyone. It's generally not recommended for those with a history of certain skin conditions or allergies to the drug. Pregnant or nursing women should consult their doctors about potential risks versus benefits when taking this drug as well. Lamotrigine is a medication used to treat epilepsy, bipolar disorder. It's used to prevent migraine headaches and treat trigeminal neuralgia in some patients. It does this by stabilizing brain activity. Always follow your doctor's instructions, be aware of potential side effects, and communicate any concerns or unusual symptoms you may have after starting this drug. Your health and well-being are our top priorities. If you found this information helpful, please give us a thumbs up and share this video with anyone who might benefit. And as always, if you have any questions or want us to cover a specific topic in the future, leave a comment below. Thanks for watching, and we'll see you in the next video. My name is Pharmacist Michael. Be happy and be healthy.